Welcome to the Balanced Hormones Empower Women podcast. I'm your host, Abby Vallejo, registered dietitian, certified personal trainer, and health coach. And what I do is I teach women of all ages how to align their diet, their lifestyle, and their exercise with their hormones in order to unlock their most vibrant health. And today I have my good friend and fellow practitioner, Courtney Cowie, back on the show. Courtney and I love collaborating together because we have a lot to say. Courtney is a nutrition therapy and functional diagnostic practitioner, and I had to get Courtney on today because we were having a conversation about hair loss and the root causes of hair loss. Because hair is so important for our identity, right? As women, especially, I think so much of our self-confidence is dictated about, oh, am I having a good hair day? Or how does my hair look, right? I mean, it's just something that is important. And not only does it matter for our confidence and, you could argue vanity, but it's really a good indicator of our overall health, right? If we have like nice, healthy hair. I mean, you can just tell it's like a symbol of good health versus, if the hair is thinning or shedding or breaking off, then we want to investigate, what underlying health causes are going on that's causing that to happen, right? So Courtney and I are going to dive in to those root causes. We've identified about 10 to 12, maybe more, depending if we get a bonus here, different underlying root causes. So we're going to go into each of those and talk a little bit more about what can be causing that hair loss, thinning, or shedding. So Courtney, thank you for being here today.
Yeah, no, I'm super excited, and it's really fun to come on, Abby, because even though you're very hormone centric, and I do a little bit of that in my practice, but obviously, as you know, I do a lot more of the gut side of things. This is one when I really started to think deeper on. I'm like, there is a very big gut connection, often with hair loss issues. So hopefully, I can bring that perspective, and even just thinking back over my own personal history with my relationship with hair and the different hair issues I've had. I think this will be really helpful for your audience, and there's probably a lot of people that will be like, "Oh my god, I was in that same situation."
Yeah, that's perfect. I love that. And I think hair, I mean, it's such a big deal, right? I mean, how many clients, I'm trying to think of how many women over the years have come to me because they were losing their hair or it was thinning or shedding and they were distraught. And I completely understand because I've had my own hair stories, which I will share, particularly with my experience on the birth control pill, which we'll get more into when we talk about how it can affect hormones. But yeah, and I remember just being like traumatized, just traumatized. So this is something that's really serious and that matters to us and that matters to women. So yeah, let's dive into those root causes. So I know that one we were just mentioning was low thyroid function.
Yeah, 100%. I think that's one that I will always, consider if someone comes to me and they're like, "Man, thinning hair and a lot of like shedding is a big concern for me." And then they're presenting with some other symptoms, right? Immediately, I'm thinking thyroid because this is
Mhm.
I mean, we've had this conversation, I know before, Abby, but, like, this is just one that's missed so frequently by conventional docs, right? Like, if
Mhm.
they're willing to look at thyroid, usually they're just running a TSH only check, right, which is thyroid stimulating hormone,
Yes.
and, I mean, we could go really deep on this, but, that's a real fickle value in that it could be high, but that could be for reasons that maybe don't pertain to low thyroid, but it's not the
Mhm.
only story in terms of what might be going on with thyroid. So, from a functional perspective, we want to be looking a lot deeper. We want to be, of course, we like to look at TSH and see that in context, but we also want to look at free T3, free T4,
Mhm.
reverse
Mhm.
T3,
Exactly.
ATPO, ATG, right? Like these
Yep,
are
the
antibodies.
antibodies, if someone has,
Yeah.
the autoimmune, which is, if they had
Yes.
Graves or Hashimoto's thyroiditis. So just for the
Yes.
listener, there's like hypo and hyperthyroid function, and then there's also those with an autoimmune component, which is even more
Yes.
severe. And that's where if it's low, it's Hashimoto's, and if it's high, it's Graves. So yeah, I love that you brought that up. And I feel like so often clients will come in, they'll mention something about hair and I'm like, well, how's your thyroid? And they're like, oh yeah, doctor checked it, it's totally fine. And I'm like, well, did they just measure TSH? And then it's kind of like, well, what's that? So like you said, that's thyroid stimulating hormone. But one thing for the listener to know, thyroid stimulating hormone, that's basically your brain. So like your pituitary, your brain telling your thyroid to make thyroid hormone. So I like to draw it out on a whiteboard. So just picture this. There's a little brain at the top, and the brain is poking the thyroid, which actually sits kind of in your throat. It looks like a little butterfly. So the brain actually reaches down and pokes the thyroid and goes, hey, 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 make thyroid hormone, make thyroid hormone. And so that's what you're measuring when you're measuring TSH. You're measuring that poke, right? But then it's
Mhm.
like, is the thyroid responding, right? Is it making thyroid hormone? And then once thyroid hormone is made, it has to get activated. And about 60% of that activation doesn't happen in the thyroid, it happens in the liver. So
Mhm.
then there's all these different steps. And then once it's activated, it has to go and bind on the cells accordingly. So it's like this whole little flow chart of everything that needs to happen for, thyroid health to function optimally. And if we're only measuring that very first piece, do we know what the rest of it is, what's happening in the right? You might be making thyroid hormone, but is it getting activated accordingly? So that's my whole little soapbox moment to say just TSH alone does not give us the full picture. And since thyroid is so important for regulating hair growth, I feel like a lot of times, and you can even see it when these clients come in and you're looking at them and they have low thyroid function. You can usually tell because their hair does look thin, right? It just kind of has that certain thinned look. And then the eyebrows too, right? Like, have you guys heard
Yeah,
about like that outer
your outer
third of the
third.
eyebrow portion, like
Yeah.
just being pretty much missing?
Mhm.
That's another really common one for low thyroid.
Yeah, no, 100%. And then we can even take this a step further and talk about how the ranges that we're looking for optimally, functionally speaking, are a lot tighter for all of these values compared to what a doctor would. So we can kind of stay on the TSH factor for just a moment too, Abby, because I think it would be worthwhile explaining just kind of iodine as a really important cofactor for
Yes,
thyroid
and that's my
function.
next one. So I love that you
Yeah,
brought up the iodine. Yes,
yes.
we need iodine to make thyroid hormone.
Yes, yes, exactly. And so this is kind of coming from the work of Dr. David Brownstein, who's done a ton of work on just looking at iodine deficiency across his patient population, which included a ton of people with low thyroid function.
Mhm.
And he talks extensively, probably compared to anyone I've heard, he talks extensively about how, upwards of 90% plus of people with low thyroid, if you test them with a urine spot test or a 24-hour iodine collection test, they will show low, right? And
Mhm.
so, in the beginning, part of what we try to do is increasingly saturate them with iodine. So we start bringing it in and increasing the quantity. And
Mhm.
what will sometimes happen when you do that over the first several months of using iodine is it will drive TSH up, right? So there's a bit of like a two-sided coin here. Like, first, we could talk about the fact that when you get your TSH measured by a doctor, their threshold to qualify for like hypothyroidism is quite high. Like, I don't know specifically, but I'm gonna guess it's like somewhere in like the 5 to 6 range and up,
I
right?
think
Like,
yeah, it's at least above 5 because I've looked at a lot of those conventional labs and they won't flag it until it's above 5.
yeah, exactly. Versus in a functional range, we're looking between 1 and 2 typically, right? So it's a lot tighter range in what we're looking to see. Now, that being said, if you're working with iodine with a client and you're starting to, and they're going in and getting it rechecked, whether you're doing the panel or your doctor's doing the panel,
Mhm.
very common to see TSH start to go up with iodine onboarding simply because more receptors are needed to kind of get it into the thyroid, and that will actually cause TSH to go up to handle
Mhm.
this like iodine saturation coming in. So
Mhm.
this is a very detailed point. I guess we're kind of jumping right into right off the bat, but I think it's important for listeners to understand because this is something that David Brownstein talks a lot about is that if you're tracking your own thyroid, you've been told you're hypothyroid, whether it's through a doctor or a functional practitioner, now you're taking iodine to support thyroid. It can be scary sometimes to see it start to go up, but with the idea that once your body actually is able to handle this increase in iodine and it's starting to
Mhm.
actually get into the thyroid, then it'll start to come back down and eventually we'll start to see things normalize. So I just wanted to make that point about TSH because it in and of itself can be a very subjective factor, and depending on what the
Mhm.
client is doing,
Yep.
whether it's iodine loading, not iodine loading,
Mhm.
we really have to consider, even if it's high, it might mean they're hypothyroid, but it could
Mhm.
also be high because they're iodine loading, right? So there's a lot of
Yeah.
different kind of
That's
squishy scenarios. Yeah.
That's such a good point. Yeah, and I think again, I love that you brought up the iodine because thinking about, well, especially where we live, in the Midwest, like it was traditionally known as the goiter belt, right? Because
Yes.
think about, if iodine is primarily found in like seaweed and seafood, and that's not a real traditional part of the diet in this area of the world. So many people traditionally, have not been getting a lot of iodine, and it became more of a problem in the 1970s because they used to use iodine as a conditioning agent and like baked goods and breads and things like that. And then they changed it for bromine. And so
Exactly.
once they started doing that, that bit of iodine that people were getting in really common foods like breads and things like that, where it would have been added in, suddenly they weren't getting that anymore. And
Yes.
so since then, the iodine deficiencies have gone up and it's really become a problem. So we're seeing it more and more and definitely showing up in hair health, which, sometimes people aren't caring as much necessarily about, oh, if this issue or that issue, but when it shows up physically, like in the hair, in the skin, in the nails, I think that's when we as women are like, okay, now I have to do something about it.
Yeah, 100%. No, that's exactly it, Abby. And like you said, that there's also this component of, okay, how does conventional medicine look at, let's say you do go in and you do have an unusually high TSH, it's like a 6, 7, 8. Your doctor's like, oh my gosh, yes, this qualifies for thyroid support. What is the number one drug most people are prescribed for thyroid, right? For low thyroid? You know the answer to this.
Levothyroxine.
Yes. And like the problem with that is we're talking about a synthetic T4 only hormone, which, you rightly said, that isn't the end of the story there. Like that
That's
has to get,
inactive thyroid hormone. So like
yes.
that, and that's just the treatment. Like every thyroid patient I've ever seen that has been on medication has been on that, either Synthroid or
Yes.
levothyroxine. Now, sometimes they'll be on like the Armour thyroid, which is the natural version. But if you go to a conventional doctor, this is what they're going to give you almost no matter what type of thyroid issue you have, you're going to get
Yes.
that levothyroxine. And all that is synthetic T4, which is inactive thyroid hormone. So again, like what if your problem is in the liver? And what if your problem is that you're making, T4, which is inactive, but your body's not able to activate it, but they're just giving you more synthetic T4. And then it's like, well, that's not fixing the problem, right? Sometimes it will
Right.
help, but it doesn't resolve it. So, yeah.
Right, right. And that's where the gut component really comes in here too, because if the person does have liver congestion or just liver overload of some sort, the gut isn't working properly because part of it, smaller part of it, is made in the small intestine or converted in the small intestine. So if people are having any degree of malabsorption issues, inflammation going on, that can also interfere with thyroid hormone conversion from inactive to active hormone. So it really misses a big chunk of it. And that's why we see, I know you probably see this a lot because you deal very directly with the hormone, but I've seen it too where people will come in on levothyroxine and still be experiencing hypothyroid symptoms.
Oh,
It's because
absolutely. Yeah, we
that
see
part
that
got
all the time.
missed. Yeah,
And they're like, but I'm on
exactly.
medication. And I'm like, well, this doesn't fix it.
No,
It doesn't
exactly.
fix it.
And that's why we wanna look at the full story, and then you can also have, in certain cases, I just actually got a client thyroid full panel back the other day, really high reverse T3, and now we've got a situation where the body needs thyroid hormone. She had lower T3, T4,
Mhm.
reverse T3 was high, and it's like trying to apply the brakes at the same time as it's like, "Oh, but we don't have enough hormone," and that can be a tricky
Mhm.
situation too because we wanna optimize thyroid function, but we also wanna look deeper and be like, "Well, what's going on here? Do you have heavy metal toxicity? Is there
Yeah.
trauma going on?" Like,
Yeah, and so for
uh
the listener, reverse T3, that's a metabolically inactive form of T3. So normally T3 is active. That's the good form. We want plenty of it because that's the part of the thyroid hormone that's going to get the job done, to make it very simple. But it
yes.
also has like this counter side, the shadow side, where it's the reverse T3, which is metabolically inactive. Now, the way that that becomes a problem is if you're exposed to like lots of toxins, like Courtney was saying, the body can actually start making this metabolically inactive thyroid hormone, reverse T3, and it blocks the receptor sites. So any type of hormone, whether it's a sex hormone or thyroid hormone, in order for it to actually fully do its job, it eventually has to bind to a receptor site on a cell, right? That's how it does its job. It delivers its message. And so if it's just out, out in the body, it hasn't bound yet, it's not doing anything, it's not active. It actually has to come and bind. And so if you have your cells and they're all those receptor sites, you can think of them as like parking spaces, right? If all the parking spaces are taken up by this inactive reverse T3, your active T3 will get there and it'll be like, well, there's no parking spaces. I can't go in. I can't do my
Yeah,
job here, right?
right.
So you can kind of think of it that way.
Exactly. Yeah, 100%. So you can start to see those more complex scenarios when you're doing a full thyroid panel and then realize, like, okay, part of it is we have to get active thyroid hormone in, but we also have to resolve the deeper issue in this particular case that's not allowing it to function to par, right? Because, and
Mhm.
that might be longer work or that might require deeper investigation to see, like, do we have an unusual toxic burden? What is really
Yeah.
going on here, right?
Yeah.
And
Yeah.
then the other interesting part I think too is that looking at the antibody side of things, right, Abby? So, like, we will often see, and this is too where sometimes the threshold standards in functional medicine are going to be a lot tighter than what conventional medicine would use. But if I'm remembering correctly, like, I think whether it's ATP or ATG, like, we want to be seeing those like in the 10 to 15 or less range, 20 at most, right? And so
Mhm.
once those antibodies start to climb into the like 21 plus or double digits,
Mhm.
that's where you're starting to think like, "All right, like, this is not okay. We've got unusual immune, activity happening against the thyroid
Yeah,
gland."
then the antibodies, and they're starting to attack the thyroid,
Yeah.
and then, what kind of damage is that causing if those are too high? So that and, I've heard people even argue that in this day and age, there's almost always an autoimmune component, and that even if
Yes.
someone has previously just tested for, like, low thyroid or whatever, we should always be looking at antibodies because we're so, especially as women too, we're very prone to autoimmune. And in our
Exactly.
world now with all the elevated toxins and pollution and everything, it's just I'm seeing it more and more people that have that autoimmune component coming in. So always something to pay attention to.
Yeah.
I want to bring it to you mentioned iodine and some other minerals too, because
Yeah.
minerals there, we'll go over some nutrients and minerals that are really important for healthy hair. So iodine, as we mentioned, is very important for the thyroid, which also, as I said, the thyroid is going to help regulate your hair growth. So you need good levels of iodine and good iodine status in order to have healthy hair.
Yep.
Other big ones I would say are like silica and zinc. Really
Mhm.
important. Silica, I know that was a big missing piece for me because I had, my hair would grow, but it would break off really easily. I was getting lots of breakage. And it wasn't until I learned about silica that I realized, oh, silica is important for like that strength and that flexibility and that elasticity. So if you're dealing with lots of like breakage and your hair just kind of seems brittle, like it doesn't have that strength and flexibility, it could be low levels of silica. So, and that's important for the skin and the nails and everything. When we're young, we have very high levels of silica. So if you think about like a baby's skin, how it's just like so like buoyant and pliant and just plump kind of thing because they're like rich in silica. And then as we age, naturally our stores of silica goes down, and that's why we get like drier and more brittle and kind of thing. So supplementing with silica, that's why you'll see in a lot of supplements for hair, you'll see like horsetail or bamboo because those are two sources of silica. And I've personally found those to be quite effective. And then zinc, you need zinc for hair growth and repair. So those all are important for healthy hair. Um, and it's worth mentioning, and you kind of alluded this too. It's not just what we're taking, but it's also are we absorbing it, right? And I would love for you
Yeah.
to speak on this a little more. Is that sometimes people come in and they're like, "Well, I'm taking this and I'm taking this hair supplement and I'm taking that," and I'm like, "Okay, that looks great, but are you actually absorbing it?"
Exactly, Abby. No, and it's funny because talking about zinc is like a perfect segue into the stomach, and low stomach acid is such a ubiquitous problem for so many people, even people without gut symptoms, right? So I see this a lot, especially in my practice, because I'm dealing with a lot of people with gut disorders and gut symptoms. The main problem there, and this is just kind of personally what I found, is that a lot of the times there is going to be in a low acid stomach some degree of Helicobacter H. pylori overgrowth. Like, this
Mhm.
is something at least I personally feel is really important to check, especially anytime somebody's having gut symptoms on top of that. And it's
Yeah, so
amazing
for
how
the
the
listener, what is H. pylori?
yeah, it's a type of bacteria. It does tend to show up in most people's stomach in some amount, right? And I will say there are like different sort of viewpoints on how much of it is considered normal, right? Just out there in the functional space. And I've even had conversations with practitioners that feel okay about giving hydrochloric acid supplementation, even if some degree of this bacteria shows up on a functional stool test. Now,
Mhm.
I will also just say that depending on the type of functional stool test a person is running, sometimes I feel like we may or may not be seeing a good representation of whether or not it's there. But what I can tell you is just in my experience, if a client is telling me they have any degree of silent reflux types of symptoms, so that could even be like things people don't even think of in terms of reflux, like fullness in the stomach, unusual fullness after eating, any kind of burping up of food several hours after you've
Mhm.
had a meal,
Mhm.
increased mucus production, especially after eating. I mean, that
Would you say
happens.
like constant like after
That
you
kind of
eat?
thing. Absolutely, Abby. And these are kind of subtle things that once clients are aware, they will start to pay more attention because they don't necessarily connect this right out of the gate, right? But it's
Yeah.
like after you eat within a couple hours, are you noticing it's worse than your typical throat clearing? Like, and that's often happening because some degree of acid is coming up. And we can talk
Mhm.
about the mechanism of why it's low stomach acid as opposed to excessive stomach acid, right? But
Mhm.
that is, mucus gets produced as a buffer to kind of keep that acid from breaking down the esophageal lining, right? So,
Mhm.
but the reason this is happening is because the stomach is kind of meant to be this enclosed, acid chamber, if you will, right? And if it's a
Mhm.
healthy functioning stomach that's making appropriate stomach acid, it should be churning and burning the food for about 20 to 30 minutes. And then when it reaches this like, specific pH, which is probably somewhere between 1 and 2, it's pretty acidic,
Mhm.
right? Like
Mhm.
the body's going to say, okay, great, we're good to go. Let's dump this into the small intestine, eject some alkalizing enzymes from the pancreas, and boom, we'll move
Mhm.
this food on. When
Mhm.
it doesn't reach that type of acidity, what'll happen is the brain will kind of be like, all right, we're not there. We'll give you more time, stomach. Let's hold on to it. And it
Mhm.
can sit for a long time. And then these gases start to ferment and build up. And keep in mind, it's not like there's zero acid in the stomach. There's always a little bit that most stomachs are producing or some amount of it. It's just not
Mhm.
enough to kind of
It has to
fully
get to a certain acidic
has to
amount.
get, yeah,
Yeah.
and so those gases will build up because things are kind of sitting in there rotting and putrefying, and then
Mhm.
over time, that can put, pressure on the pyloric sphincter, and some of that can start to, like, escape up into the esophagus, and that
Mhm.
either will be felt as expressed acid reflux or these more silent types of reflux, and I find, in a lot of people, it's the silent stuff showing up as
Mhm.
much as it is the acidic, so
Mhm.
that's a bit of just a physiology understanding kind of piece to this. But one of the things people don't realize is that the body actually needs sufficient zinc to build sufficient hydrochloric acid, right? So like
Yep.
it becomes this like chicken and egg cycle where if zinc
Yes.
stores are low, well, the
Mhm.
person's probably not making stomach acid. So how do we fix that problem? We have to get enough zinc on board, but we also have to help the body by sometimes supplementing acid or clearing the infections like H. pylori if they're there,
Yeah. Yeah.
preventing that acid, right? So we can start to cleave enough zinc from our food and then get enough to build acid, which then supports the whole hair growth part of the thing, right? Because we need to be breaking down and getting these nutrients to support good hair growth. So
Mhm.
that's a big problem, Abby. And then the
Yes.
second most common thing that I think shows up a lot with the gut population is small intestinal absorption issues. And man, there could be a lot going on here, but just to use kind of a big buzzword, SIBO, small intestinal bacteria overgrowth, right? Like that is one that I see show up frequently in the population I work with because it will tend to cause symptoms like diarrhea, bloating, constipation, stomach cramping because of all of the like bacterial overpopulation and migration into the small intestine to feed off of this, food source and
Mhm.
or because the cleansing wave process of the small intestine isn't working properly. It could be a lot of things that play into that, but that too can steal nutrients from the body, whereby if that bacteria wasn't populating, the body would be absorbing it, whether it's minerals or vitamins. And so over time, as that goes on, that can lead to a lot of hair loss. And I actually just had a client I ran gut testing on, no gut symptomology. This is sometimes the part that blows your mind, right? Like
Mhm.
she had a major elevation in the hydrogen sulfide producing bacterial strains in the functional stool test I ran. Not only that, but she had a lot of elevations in the hydrogen producers. So the normal guys that we want to see in the gut,
Mhm.
but not in excessive amounts. And so I looked
Was
at
she
it.
having other symptoms like hair loss or something like that?
Oh, totally,
Okay,
totally.
so she was presenting like she was coming in with hair loss, but she didn't have any like typical gut symptoms
Gut
that she
stuff.
was
Right, right, right.
associating with
And
it.
this is the part that's so amazing. Like, when I went through Allison Seebecker's Super Pro course like 5 years ago, one of the things that blew my mind that I learned in there was that upwards of like 70 to 80% of all autoimmune disease has SIBO underlying it, right? And that could be things like
Wow.
RA, it could be MS, it could be so many things that are
Well,
not
that just
gut
makes so much
specific.
sense because if you think
Yeah.
about like the majority of our immune system lives in the gut.
Yeah,
Right? So of course,
exactly.
what's going on in the gut is going to be directly impacting our immune system. And if there's all kind of imbalance and microbial overload and things like that happening,
Yeah.
and that immune system has that constant challenge, you can see how that would easily turn into a hyper vigilant immune system, right? Because it's like, oh,
Yes.
there's these ongoing issues. We're not safe. I'm going to just stay really, really vigilant. And then, too much of that over an extended period of time, suddenly you're in like this autoimmune condition where your immune system has just been hyper activated.
Totally, exactly, and I think because of that immune dysregulation, it will sooner or later involve the GI in some way, right? Like, these are often people that aren't digesting their food very well either, right? And they
Mhm.
may or may not be feeling that from a
Yeah.
gut perspective, but no, and like a couple of just key things kind of related to SIBO, just golden nuggets, like restless leg syndrome has a very high degree of correlation with SIBO, and again,
Oh,
just
that's another one I didn't know. And, I feel like I hear that a lot. People will come in and they're like, "Oh yeah, I have restless leg."
yeah.
Wow.
Yeah, and then iron deficiency is big, and that does relate back to hair loss and hair growth.
Yes.
Like, that's another key nutrient that can happen, especially in a gut compromised person. It's not always from excessive menstrual bleeding, or, rarely is it from like a bleed in the intestines. It could be, but more often than not, what I see is low stomach acid and SIBO at play, right? With that one, where people are like getting it, they're eating red meat,
Mhm.
they're eating
Mhm.
foods rich in iron, they're
Yeah.
just not able to absorb it. And so yeah,
That
so
yeah.
that's huge. Like, I guess those are the 2 biggies. Like, I'd say stomach acid and then the underlying H. pylori piece of it, and then
Mhm.
also the SIBO and how common that is even in people who don't realize it because they're not
Yeah.
having these gut symptoms, right?
So the stomach and gut infections. And I'm glad you said iron because that was the next thing I wanted to talk about was like anemias, like B vitamin anemia
Yeah.
or iron anemia. And I think that just ties in so well because like think about vitamin B12, iron, like you just said, you need good levels of stomach acid to absorb those. So even if you are taking them, if you don't have the stomach acid component and that, good digestion, it's going to be hard for you to absorb that. And then if you're low in either of those, in iron or your B vitamins, that can definitely affect hair.
Yeah. Oh, 100%. Yeah. So I think it's super common and there's a lot of crossover between the hormone, hair. We could kind of put that sort of in the same general category and then the gut world with that. And, just depending on kind of how bothersome these symptoms are, like the hair stuff could be there. And in my world, sometimes it'll come up secondary, like, I really need to fix this gut issue. But by the way, if I could like fix the hair stuff and I could like
Mhm.
lose weight, that's like icing on the cake, and I'm like, "Well, yeah, why don't we
We're
just
gonna do
address it?
all of that
We're
because in
gonna do
fact we're
all
all
of it," right? So,
interrelated.
it's so ubiquitous. I mean, this is why this conversation is so important because I think, what people will tend to do in the beginning is look for a quick fix themselves and go to Walmart and pick up some
Mhm.
hair, skin, and nail stuff. "Oh, so, like, look at this." Oh, and we should talk about biotin too, Abby,
Let's
because that's
definitely talk
another.
about biotin, and I
Yeah.
also wanna talk about those scalp oils that people get that have, like, rosemary in them. Now,
Yeah.
I'm not against that at all, getting a good like, I am the person that in my conditioner, I'll put a few drops of essential oil. I usually do, like, rosemary, peppermint's another good one, or tea tree, especially if you have dandruff and you're looking to, like, clear up the scalp if it's flaky or anything like that. I love that. I do that. That's
Yeah.
wonderful if you have issues with your scalp or you're just looking for a deeper cleansing of, the scalp. Sometimes we can have fungus and things in the scalp that are like impeding good hair growth, and that needs to be addressed. However, that is not the end all be all. So when someone's like, "Oh yeah, I've been applying this like rosemary hair growth oil to my hair and like nothing is happening."
It's
And
like
I'm
a
like,
Band-Aid. Yeah, it's
it's a
like a
Band-Aid. It's like,
temporary.
well, that's good for your scalp, but there's so many other factors that that we're talking about and we'll talk about that, are involved in your hair. And as you can tell from the conversation so far, just like the whole digestion piece and, are there
Yeah.
underlying gut infections? Are you absorbing and digesting properly what you're eating? I mean, if those things aren't in place, just putting some rosemary scalp oil on your hair isn't really going to do much, right?
Yeah, and as we're on that, I just wanted to take a real quick minute to talk about, like, with the scalp piece of things. I mean, I think another secondary problem people are dealing with, and sometimes they just feel too embarrassed to admit it, is like flakiness, right? Or
Mhm.
some degree of even eczema on the scalp. And
Mhm.
Although those oils can help, it kind of to me, the big thing that comes up is like, you are wheat sensitive. And again, that gets back to the gut. Like,
Mm,
I've just found wheat sensitivity and skin issues across the board, whether it's
yeah.
scalp or the rest of the body, like huge degree of correlation. And that's the other thing. So if you are wheat sensitive and you don't know it, it could be a wheat sensitivity damaging those villi in the small intestine, which are necessary to absorb. They're like these little hair-like projections that absorb
Mhm.
your smallest food particles. All your vitamins and minerals go through those babies, right? Like they will get kind of like blunted and eventually like in severe cases like celiac, they'll lay flat, right? And that's a
Mhm.
severe malabsorption issue. But
Yeah.
I think people don't realize sometimes like you could put anti-dandruff shampoo and rosemary oil on your scalp all day long, but if you're eating like bagels and bread and like muffins and
And
like
it's just killing your gut and you're not
killing your gut,
absorbing,
yeah.
yeah,
Yeah,
you've
and
gotta
it's
look
all
inside.
yeah, and it's all white flour, wheat flour products, like, oh man, like you're never gonna climb that hill. Like that's where you
Mhm.
have to start. You have to start from the inside out, in my opinion, with that type of
Yeah.
thing.
Yeah,
So yeah.
absolutely. And you had mentioned biotin as well, that you
Yeah.
wanted to touch on that.
Yeah, so biotin, you could probably fill in on the hair end of things, Abby, but one thing I will tell you, this just came up actually a couple days ago in my world, and you'll know this too because you run a lot of Dutch tests. So biotin is a cofactor needed to convert um, basically your body's cortisol production. So there's a hormone pathway where we've got the mother hormone, pregnenolone, which kind of builds all of the hormones in the body including cortisol, which is the body's fight or flight hormone. Sometimes what I'll see when I run hormone testing on a client, not often, but sometimes is elevated cortisol and very low progesterone. And so I know you're going to talk a lot about having robust estrogen progesterone to have really good hair growth, right?
Mhm.
So if we're missing biotin, sometimes it can be an inhibitory factor not allowing cortisol to convert into progesterone properly. And so I find it so fascinating just to think that like that could be a reason why maybe your hair is being impacted because not
Yeah,
only is it needed,
absolutely.
but it's not allowing good, robust progesterone levels. Now,
Mhm.
consider like obviously if it's a postmenopausal woman, it could be that playing a role as well if she's low progesterone. But
Mhm.
presuming it's a cycling woman who should have pretty high levels of progesterone around the luteal
Mhm.
phase, right? Like you
Mhm.
should be seeing. And if the nice thing about the Dutch is it will run a short organic acids profile at the end, which is a
It'll
nice
measure
little
biotin. I was
yeah,
just
it
gonna say
measures
that. I love
biotin.
that
It'll
about Dutch because 'cause it'll measure
yes.
those other things
It'll
like
measure those
biotin, so
things,
you
and so,
can
like yeah, literally just the other day, I'm like, "Oh my god, like, high end of range for biotin, interesting," and I
mm,
had to look back, I'm like, "Oh, yeah, high cortisol, low progesterone," like, "Aha, like, we've got an issue here."
mhm,
So, she didn't necessarily present with, like, "I'm having hair issues," but I bet if I were to go and dig deeper and say, like, "Hey, by the way, have you noticed any, like, reduction in your hair growth or your luster or your thickness," right? Like, I
mhm.
bet it would have been there. So it's just interesting to look at like some of those very specific mechanisms that these vitamins play in the body that support hair growth.
Yeah, yeah, and I feel like biotin is one that a lot of people have heard of because I do often see, like, people come in and they're on something for hair, it usually is biotin, so I feel like
Biotin.
that's one that most people have heard of. Yeah,
Yeah.
but bringing it to the hormones, yeah, absolutely, because estrogen, I would say, is the main female sex hormone that really is important for hair, like thickness, hair growth. I mean, I tend to, when I see a woman with like a really beautiful thick head of hair, I'm like, she must have good levels of estrogen. Like that's the first thing that I think of is like, wow, her estrogen must be so robust. Like, look at her head of hair.
Yeah. Oh,
Yeah.
sure.
And progesterone secondarily, it's also important, but I would say primarily estrogen. And this is, kind of bringing me to some of my own struggles that I've had. My estrogen was really low. Like when I tested my hormones at age 35, I could have been, it looked like I was 65. Like my hormones were so depleted, my estrogen was so low. It was postmenopausally low. And I looked at it and first of all, I wanted to cry. I was like, "Why?" But then, I was like, "Okay, this makes so much sense because ever since," and I had been off birth control for over 10 years at that point. So I had
Mm.
all those issues with the birth control pill back in my let me just jump back there quickly, back in my teens and early 20s, and my hair actually did start falling out. on the birth
Mhm.
control pill. Now, I know that doesn't always happen, but I've definitely spoken to other women where they had that happen as well. They're on the birth
Mhm.
control pill and their hair literally started falling out. That happened to me. It didn't fall out in like patches, but it just thinned. And my hair is
Mhm.
naturally curly. It started growing out straight, but not like a pretty straight. It just looked dead. Like it looked like it had no life. So I like lost my curls and my hair just started like thinning. And I remember being and bringing it back, I was so traumatized. I was so traumatized because hair is so much of an identity. And it's funny, growing up, I never really liked my curly hair. And then as soon as I lost it, I was like, like, what happened to my identity? And I've spent so long trying to get it back. Oh my goodness. Um, and so what was happening is that my levels of estrogen were plummeting because, I'm on this synthetic, basically hormone replacement, which is what the birth control pill is. And when you're replacing your hormones with synthetic things, your body isn't making its own. And so my estrogen levels just went really low. And I think I might have had a tendency probably just to be a little low estrogen anyway.
Yeah.
And so hair started thinning, skin was really dry, getting those almost like menopausal symptoms of low estrogen, like hot flashes and night sweats and vaginal dryness and things like that in my 20s, all because my estrogen was so low. And
Mhm.
then what I realized later on when I, ran the Dutch test on myself and I looked, the other piece of the puzzle as far as hormones go, and we tend to think about this as it relates to men, but if testosterone is too high, think of like male pattern balding, right? Now it's not just testosterone, it's this form of it's like this ultra souped up form of testosterone. So you have testosterone and then you have something called DHT, which is dihydrotestosterone. And this is, I like to say it's like testosterone on steroids, right? So we have testosterone and he's a good guy. He does his job, he takes care of us. He's a good man, right? But then you have the guy on steroids and he's angry and he's aggressive and he has body acne. And, just think of a guy on steroids in the gym, how he's acting, right? And so, genetically, I have, and also lifestyle epigenetically, have a little bit of a predisposition. We all have testosterone as women, and then that can get made into this DHT, this ultra souped up, jacked up form of testosterone. And so when I looked at my Dutch test, I could clearly see that my body was diverting too much of the good testosterone into the bad, into that DHT. And in women, it also does cause balding and it does look much like male pattern balding. And so that's another thing that you need to take into account, because you could be looking at all the other pieces, but if your hormones are out of balance, and like me, my estrogen was really low, my DHT was too high, my hair was thinning, and it actually causes like the follicles to shrink and get smaller. And this is what happens when men start to go bald, right? Like at first, the follicles shrink, they get smaller, and the hair gets like baby fine. And then eventually it just doesn't even grow out of the follicle anymore. And then you get the hairline receding and the baldness. And so that was starting to happen. Not as bad, thankfully, not as bad as it happens to some men, but that was starting to happen. And so what I had to do was, herbally address, there's things that you can do to kind of block, like saw palmetto is a great one to help block that conversion from testosterone to DHT. So you retain your good testosterone and it doesn't all get made into DHT. So blocking that pathway and then adding in, for me, what worked really well was actually non-GMO organic sprouted soy. Now I know there's a lot of like controversy with soy. People are always asking me, like, is soy safe? Does soy cause cancer? First of all, no, soy does not cause cancer. If soy, think about it, like there's nothing that would grow naturally that Mother Nature would give us, like foods, natural, good quality, wholesome foods that would cause this. But if it's been adulterated, if it's been sprayed, if it's not been processed properly, if it's full of toxins and chemicals, right, then of course it can be harmful. But if you look at cultures like, let's say, Asia, right, where women traditionally they consume lots of soy and they have lower rates of things like breast cancer. Like the data there is very obvious. So why is that? Well, if it's not sprayed, if it's not GMO, if the soy is fermented or sprouted, like ways that it's been traditionally consumed, those forms of soy are protective because what they do is they support a form of estrogen that is very protective and actually helps protect us from things like cancer and breast cancer. So, just for the listener to know, it's not is soy good or bad? It's what is the quality of your soy. And so, for me, particularly knowing that I had low estrogen, it worked very well for me to bring in this particular sprouted soy supplement that really helped. And so, there's kind of a funny story here, actually, that I'm just going to share. is that it was actually a pet supplement. So what happened is that my mom was getting this non-GMO sprouted soy granules for our dogs. So we have three big dogs. They're Great Pyrenees. And if you've seen Great Pyrenees, they're like white and they're fluffy. They have lots of hair. So they shed a lot, right? So we're out dealing with lots of dog hair. And so she had learned that if you give this to dogs, it basically stops their shedding or greatly reduces it. And in fact, it does. It's so impressive how little these dogs shed with the amount of hair they have. And so I was thinking, gosh, my hair sheds a lot, like crazy, which is a big curly hair problem. But, I would I'm like, how do I have any hair left on my head? Because I'd get out of the shower and there'd be like a ball of hair. Like it was so traumatizing, but it was just always happen. I'm like, I don't know how my hair's still growing with the amount I'm losing. But anyway, so it's like, okay, I'm going to try this. And so I started trying it. And within a week, my hair, it like cut the shedding in half or more. It was so amazing. And so since then, I've actually shared it with some of my clients and we kind of jokingly call it the dog food. Like, have you taken your dog food? I mean, it's human grade. It's a very good quality company. It's just funny because there's pictures of dogs on the front of it.
Oh, for sure. Well, and it's funny too, because just as like a little bit of a side note, like sometimes I actually recommend clients give human supplements to their pets, especially if
Yeah.
they test positive for parasites, because
Oh,
believe it or not,
yeah.
those can be transmitted from pets and pets can be very asymptomatic. And I mean, parasites we could argue could be more benign in a pet than they could in a
Mhm.
human, especially if they're compromised gut-wise in other ways. So yeah, there's really not to say like it really kind of comes down to is it like a well-made supplement that whether you give it to animals or humans, like, you could absolutely do that. There's no, like, rule book that says, like, "Well, this was made for humans, pets can't take it," right?
Yeah,
So
it's really just like labeling laws, right? Like they can't
totally,
label that it's for both, but
totally.
if it's like a good quality, there's no reason that it can't be used interchangeably as long as it's something that's safe for animals or, safe for humans. But,
Yeah.
soy is definitely one of those things. So yeah, I found that really helped. That made such a difference. So, kind of working on like boosting the estrogen and then help bringing down the shedding factor. So yeah, hormones definitely play a big role in hair for sure.
Oh, for sure, Abby. Yeah, and I think you're kind of touching on just the whole bio individuality of diet, and I mean, obviously, like the goal is if you can eat a very diverse diet and you can utilize soy as part of that, and you handle it well, like 100%, it can be helpful in that context. I know for a lot of people potentially listening, like they may have some gut issues or some other things going on, and so one thing that I will tend to like use if I see more of the low testosterone, low estrogen, they're the same hormone pathway. And I'm sure you've talked about that in other, past episodes too, Abby. But what's
Yeah,
great
let me
about,
just insert this.
yeah,
Ladies, did you know that we make our estrogen out of
from,
testosterone? That's what Courtney is
yes,
saying. Like you
yeah,
literally have testosterone and then your body will make estrogen out of it. So you need testosterone in order to even be able to make estrogen. And I think a
yeah,
lot of women are really shocked by that. So I just wanted to
for
share that little factoid. Yeah, go ahead.
For sure, for sure. Yeah, and I think just kinda as I'm thinking about this a little bit more, we're talking about this, like, I think this is why it behooves every single woman, if she really wants to be proactive in her health, to do hormone testing. I mean, I would pick the Dutch because of all of the things that we can get from that particular test, but, never make assumptions about where your hormones are at because there's a part of me that's like, now that we're saying it's testosterone to estrogen conversion, right? Like, a very common problem that we both see is over aromatization of testosterone to estrogen, meaning that
Mhm.
a woman has adequate or maybe even low testosterone and she's making a crap ton of estrogen from that, right? Because
Mhm.
that pathway is
It's like
upregulated.
too open.
Too
Mhm.
open, and so if she didn't know that or she didn't know maybe she was estrogen dominant and she is starting to eat a lot of soy, not knowing, not testing, right, like, that could be a
Mhm.
problem because it is very estrogenic, right,
Oh,
which
yeah, absolutely, and I'm glad that you said that because, like, soy worked for me, and it works for me because my estrogen levels tend to be low. I tested that, I
yeah,
knew. So, do
yeah.
I use it with clients when their estrogen levels are low and it's appropriate? Yes, it can be one
Yes.
of the factors, but would I give it to every woman across the board? No, I wouldn't. And that's why,
Right.
like you were saying, it's so important to test so
To
you
test.
know, because certain things work great, but they don't work great for everyone. If someone is estrogen
Yes.
dominant and you're giving them soy, it can make that situation worse. So,
Yeah, yes, exactly. So, kind of an alternative to soy, I was just going to offer up if this is something that the listeners interested in and they want to explore hormone testing. Maca root can be a really great support there too. And it's not just go get that off the shelf at Walmart, right? We're talking about like high quality, and Abby
yeah,
and I both work with really high quality manufacturers of a number of different products that can support
very
hormones.
picky.
Yeah, and they do, quality testing on their products. So it would be a very pure, very concentrated, very specific, high grade type of maca. And you've got black and you've got yellow, and they can kind of support in different ways. So, that's something that I will tend to use in my pre and perimenopausal women who might not quite be ready for bioidentical hormone
Mhm.
replacement therapy, but similar to what Abby's describing, like they've got low estrogen, they might also have lower end testosterone, right? And we just need to try to like boost that pathway.
Yeah.
So,
Yeah, and
yeah.
I love that you brought that up because that's definitely the approach that I like taking. When a woman's in her 30s and 40s and her hormone levels are low, I love doing it with like food and herbs and
Mhm.
and not quite getting, I was going to say as natural as possible. Bioidenticals are natural as well, of course, but I tend to like to wait, until a woman is really quite close to menopause because even with a bioidentical hormone replacement, it's completely natural. It's an exact identical match to the hormones that your body naturally makes. So it's very safe.
Mhm.
However, like hormone replacement therapy, once you start using it, your body is going to be making less of its own endogenous hormones. So when we're in our 30s and 40s and we still have pretty good, robust levels of hormones, or we should, and the body should be producing that as we ovulate and go through our monthly cycle, I do think it's more appropriate to support that with, things in the diet and nutrients and herbal things like maca, like chaste tree to support progesterone, things like
Exactly.
that. And then I tend to find once a woman goes through menopause or gets close to menopause, those things then often aren't enough because their hormone levels are dropping so much that then that's
Mhm.
when we bring in the bioidenticals. But then once she's gone through menopause, she's not going to get those levels back naturally, right? Like those things
Exactly.
can help, but then, at that point we bring in the bioidenticals because they're more potent and they make more of a difference.
Yes.
So yeah.
Exactly. I agree 100%, Abby. And it's kind of case by case. And if we try the softer approach and we measure again in 3, 4 months and it's like, this isn't really shifting much, and she's having quite a bit of like symptoms around hormone imbalance, sure, we can go there, right? Like, but yeah, it is, I like to go in with like the softer hitting stuff first and see like, can we get the body to do this on its own, right?
Yeah, yeah,
Yeah.
absolutely. Let me see what else on my list did I want to talk about. Oh, protein. That is one I wanted to mention because this is such a simple one. Ladies, most of you are not getting enough protein. And I feel like I'm always saying this. I'm like, are you getting enough protein? But this is
Yeah.
so important because hair, you literally like your hair, your nails, they're made out of protein, right? So if you're not getting enough protein, you're not going to have enough raw material to literally grow your hair, grow your nails, things that we want to be full and lush and beautiful. So eating enough protein is so important. And
Yeah.
I've noticed such a difference. Obviously, I said I added in the soy and did some other things, to help balance my hormones, but also just eating a protein rich diet. I literally try to eat my ideal body weight in pounds. For me, that's 150 pounds. I try to eat 150 grams of protein a day. Now, not everyone's getting quite that much, but you probably could get more, especially if you're not making an effort to eat a lot of protein. And what I have noticed is when I do eat that much, not only is it easier for me to build muscle and stay toned, but my hair and my nails, oh my gosh, they grow like crazy.
Yeah, and you've got your digestion optimized too, Abby, which is the other side of this coin, right? Kind
I
of back
I
to the
do, and
stomach.
so,
Yeah.
this is, keep in mind, obviously, if someone has impaired digestion, because I'm glad you said that. Again, going back to the same thing, you can be eating all this protein. Are you digesting and absorbing it? Right?
Exactly. So
Yeah,
it's
so
both of
that is
those.
always a key piece. So really, yes, you have to make sure. I would say first and foremost, before you spend money on protein powder or supplements, I mean, always make sure that your digestion is dialed in first, because if you're not in digesting and absorbing, it doesn't really matter what you eat or what you take. You're not going to
Mhm.
get the benefit from it. So that's honestly, I would say that's step one. Once you have that dialed in, then yes, then there's things you can supplement with, get your iodine, get your silica, get your zinc. You want to make sure you're getting those minerals, that you have plenty of B vitamins and iron in the diet, that you're eating protein. I mean, those things, good vitamin D, you're eating those essential fatty acids, that all of those things are so important for good health and good hair health specifically. But yeah, if you haven't addressed the digestive piece and that's a problem for you, you can be doing all those things and, like I said, you wouldn't be absorbing it.
Yeah, no, I'm with you. And I see low protein a lot on my female clients' food journals. And this is where too sometimes, and this might be a good tip just for the listener, like I do feel like if it's hard to get protein in breakfast, especially, that's the one meal of the day where people I feel really fall off because they're rushed, they don't have time to cook a meal,
They've been
who's
conditioned
gonna.
to eat cereal.
Yeah, yeah, like we're the cereal pastry culture, aren't we? Like, and
Mhm,
grab a coffee on the way, right? Like, and
mhm,
we got to make those baby steps. But a lot of the clients I work with, and I'm sure you see this too, Abby, they're just busy people. So part of what I have to try to help them with is how do we make smart, more convenience but high quality food choices to get your macronutrients, your protein up, and then overall just make your diet more high quality. And this
mm,
is where I will tell them, like, hey, if you get, and I'm a big fan of collagen peptides and bone broth because most people can drink those powders or use those powders and they're not going to aggravate the gut or provoke
mhm,
the immune system. You've got a lot of options out there for protein powders, but they're dairy free, they're like lectin free. I think about, like, the pea protein powders, the whey protein powder, like those can sometimes be a problem if you've got
mhm,
food sensitivities or allergies or even just a really screwed up gut and you
yeah,
struggle to do more plant-based types of protein powders. So if you do collagen, it kind of helps bypass a little bit needing the stomach acid to absorb it. So,
mhm,
if I suspect or see signs of protein malabsorption, I'll sometimes tell a client, like, hey, maybe instead of actually having straight on animal meat for one meal a day, you actually use a couple scoops of protein powder because we're getting it in at least. It's not going to add to this
yeah,
problem of protein putrefaction, which is going on every time you're eating protein. So we got to correct
mhm,
that too. But
yeah,
it is like you said, we got to get it in. And sometimes it can make sense to use a high quality protein powder to help support
mhm.
that.
Oh yeah, absolutely.
Yeah.
And I particularly, because I'm a little sensitive to dairy sometimes, so I tend to forego the whey, even though it's very high absorbable. But I do
Yeah.
really well. I have like a grass-fed beef protein powder that I
That's
use
awesome.
that is
Yeah.
like really clean and easy to digest, and that one has worked really well. So
Yeah.
yeah, getting definitely think about the protein aspect if hair is an issue. And that's just, it's so important for women anyway. And I could go on the whole tangent of like how you need to build muscle and work on your strength and all that. You need protein for that as well. So
Oh, for sure.
another thing that I wanted to touch on is post-viral syndrome. And I feel
Mm.
like this really came to everyone's attention during the pandemic and after. And I don't know about you, but that's when I really started to get that influx of women coming in going, I'm losing my hair. I mean, how many
Mhm.
women did we hear that from? It happened to me too.
Yeah. Oh, it did for me too,
Yeah.
Abby. And I had it multiple times, right? So
Mhm.
it was kind of like, and I don't remember if it was a few months post recovery or there
I
was a
love that you
delay.
said that. It's
Yeah.
usually about 3 months after you, okay, so like you get a virus. And then because your hair health reflects where you were at 3 months ago.
Yeah.
So, and I think this is why it confused a lot of women because they'd like say they'd had COVID and everything, recovered, didn't get long haul or whatever. And then suddenly 3 months later, hair is thinning, shedding like crazy. And they're like, that was 3 months ago. Like, what is happening? What is going on with my hair? So that's why I'm always telling people when it comes to hair, think back 3 months ago. What happened? Like, did you get sick? Were you really stressed? Were you dealing with some type of challenge? Did you start some new medication? Like, what changed in your life about 3 months ago? And so often they'll look back and go, oh my God, I know why. So, I just wanted to touch on that because this was such a huge problem and so many people experience this. And I say women, I'm sure it happened to men too, but women are the ones that come in and ask about it. Like, my hair's falling out, like help, what do I do? And I think I at least, and I'd love to hear your thoughts on this. I think for me, a huge part of why I think that happens is when you get an infection, it can really decrease your stomach acid and your digestive capacity. And I know
Mhm.
that was the case for me. Like, I had really done a lot of work on my gut and my digestion, had COVID, suddenly not digesting things so well, and had to work on like rebuilding that. And that kind of coincided with, then if your digestion is down, you're not absorbing those, the protein and the vitamins and the minerals that you need for healthy hair. And then suddenly it's showing up, right?
Oh,
What would your thoughts
for
on that be?
for sure, Abby. No, I agree with that. And I think like this will kind of also touch on a couple more topics I think you'll want to speak on, which is just like the stress response that also gets created when like you get sick, right? As well as like chronic inflammation. Like it's pretty inflammatory. And
Mhm.
what I noticed, and I heard this kind of similarly from other people, is that like my baseline problematic issues, which typically are gut for me, got so much worse when I had COVID. It was like I got
Yes.
COVID, but then everything else roared up like 10
I feel
times,
like
right?
it just what COVID did is it zeroed in on any vulnerabilities. Cause like for me, it was
Yes.
circulation, which was sort of bad before. And then
Yeah.
with the COVID and after it, it was awful.
Exactly, exactly. So it was like something about it, it just was a very inflammatory like cycle of things that got set off. And I think depending again on the level of severity, because I had it a number of times. It wasn't always the same, but
Mhm.
and this is kind of true for me anyhow. I just noticed with viral stuff, even if it's just a regular cold flu virus, like I will tend to have an exacerbation of gut symptoms with that. And I
Mhm.
think it's those like sort of tried and true to inflammatory pathways that just everything gets kind of increased. And so,
Mhm.
I would also attribute it to the fact that like when the body is dealing with that kind of unusual stressor, it's just not like you've used this phrase before, Abby. It's just not the time to be growing beautiful hair. Like,
Yeah,
you know what I mean?
exactly. I
Like,
love it. It's
it's
not
not the
prioritizing
time.
that. When it's focused
Yeah.
on survival, it doesn't
It
care how
it's
you
like
look
energy.
or
Yeah,
how
it's like
your hair
energy.
looks.
Exactly,
Mhm.
energy conservation, right? Like, it's like
Mhm.
the law of energy conservation, like, all those additional resources that go on, autopilot when we're good and well and calm, that
Mhm.
now goes towards managing the stressor in the body, and so I think on
Mhm.
some level, I can't explain the detail of that mechanism, but I believe that besides, just the low stomach acid and digestion going down, that could
Mhm.
also be partly because the body's like, "We got a stressor, and so we gotta dial
Oh,
down these other
yeah.
functions,"
Yeah,
right?
that's such a wise point. Like the body is not wasteful. And so it's going to send those energy reserves where they need to go. And it's not going to prioritize our hair or our nails or how we look or anything like that when we
Exactly.
literally are surviving.
Yeah, for sure, for
That's
sure.
such a good point. Yeah. So chronic stress was kind of another thing that I just wanted to mention. And that ties in so well, because maybe you didn't just have an infection or something, but you've been living in a very fast-paced, stressful lifestyle for a long time. Again, if your body's in that like fight or flight survival situation, even if your life's not actually being threatened, but your body doesn't know that. If it feels stressed, it's going to release that same stress chemistry. So if that's happening, it's really not going to prioritize, your physical, like your beauty or, your hair or your skin or your nails or anything like that. So that's another
Yeah.
thing to keep in mind, even if there's not been an immune challenge, but you're just dealing with a lot of stress. Your hair can definitely fall out and shed, even just because of stress. If you've gone through if you've gone through a stressful situation,
Yep.
especially if it hasn't resolved, for sure. And
Yeah, no,
then, yeah, go ahead.
no, I was just gonna say, no, I agree with that 100%. And I think again, we could tie that back to high cortisol tends to drive down the sex hormones, right? We need sex hormones for hair growth. It drives down stomach acid. It
Oh yeah,
drives down
yeah, it's
like
all
it's
interconnected. Like
all of
don't
that.
ever let
Yeah.
modern Western medicine make you believe that everything is separate. Like
It's
it
not.
tends
Yeah.
to be very compartmentalized so everyone has their own little specialty, but that's not how it works in the body. Everything in the
Yeah.
body is interconnected. And so that's why when people come in and they're like, "Oh, just give me one thing for hair." Like I just need
It's
the
like,
one
no.
the one supplement that's gonna make my hair grow. And you can tell if you're still listening to this conversation, you can tell why there is not just
Yeah.
one
Abby,
because
you
it's
mean
like
you don't get out your bottle of biotin and be like, "Here you go." Like
and it's like sometimes that's what people want, but I would be
No.
completely remiss if that's all I
Mhm.
did and it wouldn't work in every
Oh
case
god.
because if there's like a hormonal problem or if there's a thyroid problem or if they're low in iodine or maybe they don't have enough iron or I mean
Yeah.
all the things that we just talked about, low stomach acid, if those other things are going on, like just the biotin is not going to fix it. So
Oh, for sure. I mean, that just is a quick story. I got a question once from like an old client just out of the blue. She's like, "I'm dealing with anemia. What herbs can I take? What Chinese herbs can I take for this? I've been researching it." I just said, That's not the right question to ask. The right question to ask is, "Why are you anemic?" That's where you need
Yeah.
to start answering this question, right?
Yeah.
Like, I mean,
Yeah, absolutely, and I
just
think that's another conditioning of our culture is like, "Well, what can I take for this?"
yeah, just crazy. It's
And
like,
we
I mean
always have to, like, take it a step back and be like, "Well, why is it happening? What is
right,
happening? And
right.
why is it happening?"
Right. Like if you're low biotin or low thyroid or low iron, sure, give those things to supplement. You
Mm,
do need that to help, but that's not the
mhm.
end of the line, right? Like you have
Yeah,
to dig deeper and be like, why are you this? Right? Why
yeah,
are you struggling with this? Like
yeah.
that's where we want to go as
Yeah.
practitioners.
Yeah,
Yeah.
and some of them are easy fixes, but
Yeah.
sometimes it's not, and sometimes you really do have to dig, but it can be so satisfying once you do and you start making all these connections like, "Oh, the
Exactly.
hormones and the stomach acid and the gut and this and that," and when you can put
Yeah.
those all together and come up with like a beautifully tailored protocol very specific to that individual, and then you see them get results, it's like, "Yes, this is what I need to do."
Exactly. Uh,
Mhm. I think one thing that we didn't mention, and I just want to touch on it briefly, is the postpartum thing because I think that's
mm,
another time of a woman's life where, and never having been pregnant myself, I'm speaking on this like, I haven't been through this myself. However, what I tend to observe and hear from women during pregnancy, usually everything gets really thick and lush and hair grows like
mm,
crazy and nails are growing like crazy. And this makes sense because all of our hormones are peaking, right? We have really high levels of hormones during pregnancy, and that makes everything just, ah, goddess. That's why we get that glow, right? That pregnancy glow, it's those high levels of hormones. And then a woman gives birth and everything goes, "Nyeh," and just
exactly.
drops. And suddenly she's gone from these really high levels to she just got completely bottomed out, and that's another reason why, postpartum depression can kick in, because, these hormones affect, like estrogen affects your brain. You need it for healthy neurotransmitters, and suddenly, like, it plummets. So that is, another thing that ties in. However, then suddenly her hair and her nails that were growing beautiful and thick, and now suddenly she's losing hair, right? Can you talk more about that?
Yeah, absolutely. I mean, yeah, no, that this is kind of one of my two hair stories, right? So I've got three kiddos, and after my first, because he was my first, and I didn't know what to expect, right? Like it was daunting, like how much hair came out. And I feel like it was sort of like the COVID scenario we just spoke of, where it took a few months. Like it wasn't overnight. It wasn't like I had a baby and then within a week all this hair shed, but I remember it being so problematic. Like I would look in the mirror and be like, oh my God, my hair is like thinning. And it wasn't as long as it is now, but it was longer-ish, and so I just thought to myself, like, "This is really bad," and I was super self-conscious about it, so I made a hair appointment to go in and get it, like, cut up to chin length or something because
Mhm.
I was just so convinced other people must notice this, like, they must see that I'm, like, thinning hair, like,
Yeah, well, because
I
it's like a part of your personality, and it's like one of the
yeah.
first things you see about someone is their hair, and I think we as women,
Oh,
we just
yeah.
really tend to notice that. I completely get it because when mine was falling out because of the birth control pill, I was so traumatized. Like, I was just yeah, I just felt, yeah,
You
like
feel
less than a
desperate.
person.
You're like, "What can I do to make it look thicker?" And I mean, this
Yeah.
is such a, like, open thing to talk about, right, as women, but I mean, these are even conversations I occasionally have with other women, like, I work really hard, they'll tell me to make my thinning hair look thicker, and just the time
Mhm.
that goes into that. So it's not
Mhm.
even just, like, the fact that we're self-conscious about it, but it's all that time we're expending to do this product or tease it or whatever the heck, blow it,
And
blow dry it upside
and
down.
products, and we need to touch on that as
Yes.
well.
Yes, which I mean, and this is kinda I know it's a bit of a segue, Abby, but I think this is why this is such an important topic because think about how much time and money it's costing you to not really fix this problem, right?
Right.
Because
Exactly.
over time, you're spending how many minutes every day? Over time, you're spending how many dollars every month on this product or that product, and, like,
Mhm.
that shit ain't gonna work, right? Like, I mean, you really you really
Right.
gotta get to the root of
Yeah.
it, and this is where I think the most proactive of the people struggling will finally be like, "To heck with this. I'm gonna actually do something. I think this is internal. I gotta get
Yeah.
this figured out,"
Yeah.
right?
Yeah. It
So,
always is, isn't
yeah.
it? When it's
Yeah.
related to hair and skin, I mean, it's, we grow that stuff from the inside out. You have to start on
Yeah.
the inside. It's never just,
Yeah.
yes, our topical is important and having good quality products to apply on your skin and your hair important. Yes, they are. But if you don't have the right stuff from the inside out, they're not gonna fix it. And so I'm glad you said products too, because I feel like
Yeah.
it's just worth mentioning the toxicity and
Yes.
chemicals in the
Yes.
majority of your conventional products, just on normal shelves, whether you go to the grocery
Yeah.
store, you go to like a CVS or a Walgreens or just, even what is it called? A Sephora,
Yeah.
like that, wherever you're buying your hair products. The normal products on the shelf are so full of chemicals, and you would think that they would test those things for safety. They have companies have no responsibility to show that those are safe. If it
Exactly.
doesn't kill you on the spot, they're pretty much not liable for
Yeah.
long-term damage that those things can cause. And
Yeah.
so I mean, that can be another piece of the puzzle to keep in mind, is that if you're using really harsh products on your hair and it's just like stripping the scalp and stripping the hair follicle, that could be another thing that's weakening your hair. Or you had mentioned hair dyes when we were talking before.
Yeah, absolutely. Yeah. So kind of on that vein, 100% Abby. Yeah, this is such a topic, this whole topic of toxicity, super passionate because I have my own personal story both with mold toxicity, but something I don't think I've actually mentioned yet on my podcast, so we get to mention it for the first time on yours is that a number of years ago, I was actually diagnosed with a melanoma on my leg. And that was probably the scariest health experience I've had because, you know, I'm not an expert on, skin cancer per se, but I will say that of the cancer realm, especially melanoma, is not as well understood as other types of
And
cancers.
isn't that more of an aggressive one?
It can be very aggressive, and so, depending on what type it is and if they can topically, basically get rid of it, remove it, which was, thank God, my situation, but,
Mhm.
I found out this is a bit of a, like, backstory, but I found out after the fact that it was very difficult then to get I was looking into, like, different insurance plan policies, like, sometime thereafter, and because I had that diagnosis now on my record specific to that particular type of cancer, because the life expectancy statistics are so abysmal if you've got an aggressive form, like, and there isn't a lot of like treatment really shown to deal with this like in the
Mhm.
way you could say other types of cancers that are easier to potentially like deal with. Like
Mhm.
I lost my ability to qualify for like a good, health insurance plan,
Oh
and
my
just
goodness.
such a like and even though, I was very health proactive, right? Like I was a practitioner at this point when this happened.
Yeah.
Like this is like a whole nother topic we could talk about at some point. Is just the whole realm of cancer and all the things that can go into that. But needless to say, I mean, I did eventually go and do a lot of genetic testing on myself. And of course, all of those like predispositions to not handle toxin elimination well, like, just some of those unfortunate like gene potentials that make it harder than when you're in the right environments under the right toxic influences, whether that was mold or chemical toxins. Like, I have to work super hard to try to keep toxin exposure to a minimum and also
Mhm.
promote good detoxification like on the regular. So I teach all of my clients this in like my program. I'm so super passionate
Mhm.
about it, but
Yeah.
one to connect this to hair, one of the big things I ended up doing, Abby, was taking a good hard look at that time in my life. Like, okay, where am I maybe getting toxins that I can like eliminate, cut back on? And one
Mhm.
of the things I was doing on the regular was dyeing my hair. And in the beginning, it was more just for the novelty of it. Like I did, the other side of my job was massage therapy. And so I had a part-time gig at a hair salon helping them out on the regular, like taking massage clients. And so just I would trade with the stylist. I'd be like, okay, you color and like style my
Mhm.
hair and I'll like give
Yeah.
you a massage. It was really
Yeah.
fun.
Yeah.
But not so fun when I started to think deeper about like, wait a minute, what's in these hair dyes? Like this is not
Mhm.
cool. And so
Yeah.
I just got that stuff out. And then, some years after that, I was starting to notice like, okay, I am graying. Like I want to be able to like, again, I don't want to look gray in my late
Still
30s,
wanna have
early 40s.
options.
Yeah, I
Yeah.
wanna have options, and so that led me down the path of looking into alternative products that could get the job done, like, say, natural forms of henna hair dyes, right, that would work pretty darn good and
Mhm.
get the toxin exposure out, and I think it's worth noting because if it's not hair loss, another super common problem that I think a lot of women experience is early graying of their hair too, right, like,
Oh,
we're
I'm glad you brought that up for
yeah.
sure.
Like,
Yeah.
we're seeing that more and more in the world, and
Mhm.
part of that is a little bit genetic driven, if you will, like, there can be these genes that sort of, when they're switched on, dictate how fast a person grays, but at the same time, oxidative stress will drive that, and that's the
Mhm.
process of accelerated aging and
Mhm.
DNA damage that can get accelerated by lifestyle stress, mental stress, poor diet, toxin exposure, like all of the things, right? Like we talk
Mhm.
about on the regular, like sometimes people find themselves years into that and they're like, my God, I'm in my like late 20s, early 30s, mid 30s. I've got a lot of gray coming out.
Mhm.
And you might be able to reverse that to a point at that place in your life if you start to deal with some of those stressors. But then
Mhm.
the truth of it is, once that starts to happen, at the hair level, I think a lot of women are like, I got to do something about this.
Yeah.
And then it's like, well, what do you use? The regular conventional hair dyes that have all these toxins. And then what might that set off because of your genetic
Yeah,
potential,
and
right?
it's so easy because you go into a salon and the stylist is just like, "Here we go, we're gonna do this." And, you're just, like,
Yeah.
trusting the professional, not necessarily thinking about what kind of poison is hidden in those
Exactly.
products.
And don't be fooled by the organic hair dyes. You have to really look at all of the stuff in
Mhm.
there because might they be a bit better than the conventional? Maybe, but still look like what is in there. And one of the
Mhm.
best websites, if the listener isn't familiar with kind of where to go to check products, like EWG, environmentalworkinggroup.com. I think they're just
Oh,
EWG.com is a
yeah,
great
yeah, and it's
starting
the
point.
Skin Deep database. I love that
Yeah.
one. I will link
Yeah.
that below in the
Yeah.
show notes because that's
It,
one I'm always directing my clients to as well. Like, you can
for
literally go in
sure.
and put in a product and brand name, or you can look up an individual ingredient and it's a neutral third
Yes.
party. They will give you a rating between 1 and
Yeah.
10 about its level of toxicity, if it's safe or if it's not safe or it's,
Yeah.
sort of safe. And so at least that way you can make an informed decision because with like greenwashing and now this day and age companies know that we want things to be organic and healthier, and so they'll make the packaging look like it's so natural, and that just like it messes with our mind. But to
Exactly.
actually go in and check like what is the actual rating on a neutral from a neutral third party like the environmental working group,
It
so
really
yeah, I think
helps.
that's yeah, it really does. I've heard henna is actually not just good as a dye, but it's also helps strengthen the hair. Have you found that to be true?
I have found that to be true. It's kind of like a natural conditioner, and I'm happy to share the company I order mine from is, Morocco Method, and so, like,
Morocco
I
method.
yep, I can send you that info, Abby, so you can put
Oh,
it in
I
the
would
show
yeah, I
notes.
would love that. I'll link that too in case anyone's interested. Now,
Yeah.
my question with henna is because I always thought you had to have really dark hair to use henna. Are there like different blends for also like lighter color hair?
So they do have a blonde blend, and then they've got even just, like, a colorless blend if you wanted to just put it on as, like, a conditioning
Oh
treatment.
yeah.
Now here's the limitation though, from what I understand, like, once you start to go more than, like, 25% gray, that's where it starts to get a little tricky, especially if you have darker hair like mine, and I'm kind of starting to get to that point, sadly, because
Mhm.
when I put it in my hair, I can see the slightly, like, bronzy tinged gray pieces where, like, the darker henna is trying to do the job, but it's still there's
Mhm.
enough of it starting to grow now. But, I've had to, I think, just over time as I've gotten more gray, go towards a darker hair dye too, like a
Mhm.
darker brown. Like
Yeah,
my
to
hair
cover it
in
more.
yeah, like, I mean, in the
Mhm.
summer, you could argue sun exposure lightens it a little bit, but I mean, at this point, I could probably use the same dark shade all of the time. It
Mhm.
still works pretty well for me, and I'm 44 as of right now, so, like, I'm hoping that it'll continue to
Yeah.
serve me well for a little while, but
Yeah.
yeah, I can't vouch for the blonde dyes just because I don't
You haven't
honestly
tried them.
know, but
Yeah, I just
they
always
do
thought
have
of
them.
henna as more of like a dark, dark pigment, so that's good to know that there's options for lighter colored hair as well.
Yeah, and they're a great company, like, I vouch for their shampoos, I really love all of their products, like, they have, like, a detangling kid spray, I use that
Mhm.
on my hair, and I use it on my
Mhm.
daughter's hair, so super clean, product company, and it's a little different type of, like, consistency of some of the shampoos, so,
Mhm.
if you go to the website, check it out, like, Anthony Morocco has videos talking about how you will go through, like, a detox from conventional shampoo to, like,
Wow.
his natural shampoos, which is a
Yeah.
real thing, actually, I've experienced that, but, it's cool, like, if this is something that excites you and really cleaning up products and stuff in your kitchen and in your bathroom is really part of it for you, like, you could really go bonkers with, like, looking
Oh,
into this
yeah.
stuff, yeah,
Yeah, I
so
love that there's so many options these days.
yeah,
Yeah.
exactly. So yeah, I've been very happy with the henna hair dye. And I mean, is it a forever solution? No. But like during that transitional probably decade or so that women are going to go through at some point, I think
Mhm.
personally, and then if I get to that point where it's just not doing the job, I'm probably just going to let it go au natural because like
Mhm.
There isn't a great option, Abby. I
Right.
mean, it just is what it is. And I think that's part of our work as women, which gets back to your whole kind of empowerment and like appreciating yourself and stepping into your best version of you theme. Like, we
Yeah.
have to start to come to terms with we are aging. At best, we're going to keep our beautiful, thick head of hair to the point we
Mhm.
can, right? Which is why we're
Yeah.
talking about all this.
Yeah.
But it will eventually gray, and then you have to kinda ask yourself, like, "Well, do I wanna keep dyeing it into my
Yeah.
70s and 80s?" Some
Yeah.
women do, but it's a
I think
trade-off.
I think that it's so beautiful and stunning when a woman has like a full head of gray hair, especially when she lets it grow. Because I
Yeah,
know, like, I know there's kind of the tendency, it seems, at least in the older generations, to like cut their hair really short when they get
yeah,
that age.
yeah,
But when you see a woman and she has like a full head of hair and it's like she's gone gray and it's like this silver, I don't know, I just think she looks so distinguished.
yeah,
Like, that's something that I'm almost looking forward to having one day, you know?
yeah,
And just thinking like, how yeah, I mean, it's because it's like a rite of passage, and we need to embrace those type of things rather than being like automatically saying, "Oh, this is ugly," or "This is not desirable," you know?
exactly,
Like
exactly. Yeah, and I think it was even, like, a hair color trend several years ago where, like,
mhm,
younger-ish women
like
were getting, like,
silver,
gray,
gray,
silver
mhm,
yeah, which is funny because like, you'd think, like, "Why would anybody do that?" But I think you're right, it's all about perspective, and I think, like yes, and it's funny because we're coming from a perspective where it's like, you could be 70 and have the hormone profile of a 35-year-old if you really wanted to, right? If you
mhm,
support the body, but yet don't eschew it all and get rid of all the gray hair. Like, I mean, there's a balance there and accepting that you aren't
mhm,
going to be the same in your 70s as you are in your 30 time frame, right? But
mhm,
let's support what makes sense without having to sacrifice like, well, to look like I'm, 20 years younger, I've got to use this toxic chemical dye on my hair. I mean,
right,
again,
yeah,
if that's your thing, more power to you. But like, my guess is you're listening to this because health and doing things naturally and holistically and starting to get these toxic elements out of your life to support your body to function well
mhm,
is a priority. So part of that has to become like that inner evolution of like, all right, I just have to accept I am getting older, my hair will gray. How can I still love that as that happens, right?
yeah, yeah,
Yeah.
I love that. So powerful, so well
Yeah.
said. Yeah.
Yeah.
Tell me how people can find you.
Oh, yeah. So best way to find me is my website, which is www.courtneycowie.com. Last name is Cowie. And if you're interested in setting up a free 15-minute call with me, there's a button right there on the landing page that says free gut check call. You can click that and it'll drop you right into my calendar.
Perfect. Thank you so much for joining me for this conversation. I feel like this one, hopefully, it's going to be so helpful. I know that this is something that interests so many women. So I'm so glad that we were able to touch on so many things that I feel like just don't get talked about when it comes to hair, like all the underlying. I mean, we love that root cause stuff. So
Yeah.
hopefully, it's been helpful to hear about all of those things maybe that you haven't thought of before or haven't even heard of. So if it helped you, be sure to give it a like, give it a share it with other women and people that you know that could also find it helpful. And thank you so much for tuning in.